one question. We will have one question for each guest, and maybe some comments also from our other guests, previous guests, if Dr. Adham, Minister of Health, and Professor Nail are still with us. Anyway, I will start with Professor bin Ghouth and maybe Dr. Samer. Actually, we have selected Hadhramout and Taiz because they are the worst governorates that have been affected by COVID-19, and maybe more or less they have the good maybe screening system, and that have been shown very clearly from the screening of infected cases. And we don't know whether that's because of the high infection rate or because of the good screening and the good governors actually. Professor bin Ghouth, my question to you, and you as an academist and as a lead in your area, and you have done a couple of situation analysis to the status of through the seroprevalence survey or to the Hadhramout in particular. How do you think, Professor bin Ghouth, you and your colleagues in academia can support the Ministry of Health and the WHO actually in providing a more accurate situation analysis and to formulate a syndicate maybe for academia to work in solidarity and be as a cornerstone or as a backbone actually for the MOH? Would you please elaborate on that?
Yes, participate in the committee in the Ministry of Health from the first wave. And so I am the chair of the consultancy advisory committee for COVID in Hadhramout. So we did with my college, the academic Dr. Sheikh from the Eden University. We worked together to conduct the seroprevalence survey in Eden in November, December, with support from WHO and Ministry of Health. And now we prepare a proposal, as Dr. Adham said, we prepare a proposal to extend this survey in Taiz and Hadhramout and other area. So I prepare some scientific reports about the COVID-19, about the mortality in Eden. Is one of the reports I prepared last year about the mortality, and this report subject of extended study about the mortality in Eden by what I said with one research group from one university in UK and published in the BMG Global Health. But also I recommend, I suggest for with His Excellency Dr. Qasim, I talked with him 2 days back about the need for establish a center for epidemiological study in Yemen. A lot of epidemiology need to be investigated in Yemen, either COVID or either cholera, diphtheria. A lot of topic need to be investigated in depth with scientific center. I think the Minister of Health can take the lead, and we are academic can participate in this.
Thanks a lot, and thanks a lot. And I liked actually the last slide that you concluded your recommendations and overall situation. But you mentioned something which I need to ask about it. You mentioned that you need it's advisable to go through to screen the new variant. Do you think it's very important in such a catastrophic situation in Yemen to know what's the variant of the virus? I mean, is it the top priority to be for Yemen?
Now the vaccine AstraZeneca is available in Yemen, but we don't know in future what the new variant will occur and how to what extent this variant affect on the vaccine, affect so in the diagnosis. So this the uncertainty of epidemiology of COVID in Yemen. Maybe due to new variant, we don't know. For this reason, I said maybe important.
Thank you very much, Dr.
Dr. Dhekra, can I only interference before leaving this point?
Of course, of course.
Well, first of all, thank you, Dr. Abdullah, and also, inshallah, will prepare for his great project in Epidemiological Center in Yemen. We are preparing for that, and we are open our door for any scientific or help for in this issue, and we are appreciate his effort. Regarding you say about variant of coronavirus in Yemen, actually with the cooperation with the WHO now, we are collecting sample from many governorates and we are sending outside to study the genotype of this variant, and we will publish this study. Thank you.
Fantastic news. Dr. Alasdair, you mentioned about the antigen rapid testing, and you might, your company actually, thankfully, might provide some support to Yemen. Is that right? Can you elaborate please on that?
Yeah, so we have provided some support in the middle of last year. This was when we provided the rapid antibody tests, which were really at that point in time they were useful. But you know, when you're trying to identify acute infections, the antibody test is useful, but it's not the best solution. Let's be honest. Now we are in a position where the antigen technology is such that at the very least it can be some component of a testing strategy. So absolutely, we are very willing to reach out and provide help in any way which the ministry would like us to, basically in that sphere.
Thank you very much. Thanks a lot. Your Excellency, Dr. Qasim, would Yemen consider also, and maybe if Dr. Adham is still with us, would Yemen, supported by WHO, would accept the strategy of introduction of antigen rapid test to overcome the problem with the unavailability of reagents of PCR and unavailability of functioning labs, etc., etc.?
Yes, I think we can start in this project, and we are open for this project. We start by rapid test in some isolation center to do a rapid test, and actually we do it in the screen and triage area. We do it now, but we can, no problem, we can let our technical staff discuss with the company, and we can see what is the opportunity for this project.
Dr. Samer,
okay.
You mentioned about al-Ma'afir, the highest incidence rate or infection rate is in al-Ma'afir, and the lowest.
No, al-Mudhaffar and Salem.
Al-Mudhaffar and and Mukha, ولا al-Makha, لا?
Al-Mukha has almost no case during the first wave. Now, after the provision of PCR, after training, they have about 70 cases.
Fantastic, fantastic. So, in your, of course, we were not able to listen to the remaining of your slides, but is there any raising awareness sessions among the Taiz governorate? I mean, to accept vaccines, and did you start vaccination as well? Is there a community participation in overcoming this pandemic?
Yes, vaccination has started about 2 days ago. However, the bad role of media and the negative impact of the media about the vaccination, especially about AstraZeneca vaccine, and the lack of knowledge about evidence-based medicine from the healthcare worker make them refuse and preclude the vaccination, as Dr. Abdulla said in the study of his partner, that 75% of the healthcare workers are refusing to get vaccinated. This is a tragedy, and this is the result of lack of knowledge about evidence-based medicine that make people believe in myths and rumors about COVID-19. People preclude to go to the isolation units because they believe that there is a mercy killing in the isolation units. Also, this is another rumor that we are suffering from, the rumor of mercy killing, the rumor of vaccination safety. Also, we have another issue is the abusive use of antibiotics, and most of the drugs that come to Yemen are not tested in the laboratories. A lot of drugs are not working, are not efficient. We are giving patients antibiotics and they have WBC of 33. We give antibiotics according to cultures and sensitivity, and we still have a high rate of infection and ineffective antibiotics. Another issue is that during the peak of the second wave, we ran out of oxygen. So oxygen is a priority. You cannot do anything with dexamethasone, with anticoagulant, with anything without no oxygen has no benefit. Oxygen is a priority in the treatment of COVID-19. And this problem is evident in India. India, the nuclear country, ran out of oxygen and is facing a problem with the new variant, with the new Indian variant. If it comes to Yemen and there is a surge in the cases in Yemen, we will run out of oxygen. This is an important issue. Another issue is the mechanical ventilators as provided for some isolation units. However, there is no electricity in some isolation unit. You cannot run or operate a mechanical ventilator without provision of electricity for 24 hours a day. Also, as Dr. Adham said, water supply in some isolation units is very important. Medicines, supplies, medications, and nutritional support also are another problem. The incentives for the healthcare worker is also a priority to make them work harder and to make the isolation sustainable, especially some healthcare worker who enrolled into the staff of the isolation unit. They get fired from their from their private works and the private hospitals because the private hospitals say, you work at the isolation unit, so you will infect us.
Thank you very much, Dr. Samer. I think at the end, I need just to give two comments. First of all, I would like to apologize from my colleagues at the questions and answers. I was not able actually to grasp all your questions, but I tried as much as I can to summarize, because there were a lot of comments and commonalities in questions, and I hope I covered everything that you raised in the Q&A. Second one, a recommendation from this session that we need as doctors in diaspora initiatives and all those who are working also in Yemen, to help the ministry, to help the WHO, to help all those who want to support Yemen by working in two pillars actually, which is the community, the risk management or the community, to make a revolution of awareness, raise awareness among the community. The second one is to maybe work on the relief by providing support through oxygen or ventilators or whatever and capacity building. I think up to here, I'm done with the Q&A, and I would like again to thank everybody who participated, who provided their precious time during the fasting period, and to have you again and again, especially Dr. Qasim. We were very, very excited and happy that you are with us, and we need you. We need to see you every time and then, and we need to support each other. Thanks a lot, and salam from my side.